Okay, buon pomeriggio, good afternoon. So I am ILIR QOSE, I come from COOSS. Marche is an Italian service provider of social services. And the name of the presentation is Innovative Tools and Data Sharing in Aging Care. So to be honest, must be in social care, because I'm speaking about social care and not health care. So all the devices and technology are going to speak about later is about social care. So it's not including medical devices and healthcare devices. Just a couple of words about the company I am here on behalf of. So COOSS Marche is a social cooperative, is a social business, is one of the hugest social care provider in Marche region, so in central Italy, and we provide services, healthcare services, educational services, training, and is a company already 35 years old, born in 1979, and we have more than 2,500 employees and partner employees, and with a turnover about 50 million euros for 2014. Who lives in Marche knows very well COOSS Marche, but the people that come outside this area, we are one of the few cooperatives that we have activities outside Italy. We have activities in Eastern Adriatic countries like Albania, Bosnia, Serbia, and we have a joint venture with a Chinese company and even some activities in China as well. This was like a investment done years ago by the company, creating an R&D department and creating an internalization team within the cooperative. At the same time, COOSS Marche is running nursing homes, daily center, kindergartens, and our main users are elderly, disabled, minors at risk, and disadvantaged people. This is just a panorama about our users. So we have more than 7,000 users. Most of them are elderly and disabled people. As I said, one of the particularities of COOSS Marche is that we have an R&D department created more than 20 years ago, and actually are working something like 20 people, and is specialized in research analysis. And in particular, as I said before, we have this project development and project management area with 15 people working on it, and we have different projects. For example, I'm in charge of European territorial cooperation, but our other colleagues work on research and seventh framework program or Horizon. And at the same time, COOSS Marche is a vocational education trained agency certified by Marche region. Just to go to the activity, to the discussion we are talking about, and we'll talk about the technology, so the innovative tools and innovative instruments to be introduced, or at least we are trying to introduce in our services about the aging care. So as I said at the beginning, we're speaking about social care and not medical care. So just an overview, as you see, as you know, the care paradigm for older people is changing, and we are moving from the frail elderly that we discussed today to an older person living with frailty, so long-term conditions. So the situation and the management is moving from health, everything based on healthcare, more to caregiving-oriented and integrated care, including informal caregivers, relatives, and community. As I said, we are moving from a frail person to a person with frailty. Today, we are moving from a situation where people, everything is based on the hospital. People go to the hospitals for in late phase or in crisis, and we are moved to a new paradigm where people will have more collaboration with a proactive participation and self-management. It's a hospital-based, episodic, disruptive, and disjoint today, and are moving always more to a community-based, person-centered and coordinated care. So what we are trying to do exactly today is to put together the health services, social services, the voluntary services, and the mental health. And this is the main change is because today, today's system is not more sustainable, and many people dislike it. And the new ways of care, when the technology can play an important role, are new services with less labor-intensive care and more technology involved in it. Just to give some numbers, so there is some data coming from mobilehealth.com. 21% of the people never heard about telemedicine, and in the category between 45 and 74, 46 of them never heard about telemedicine. But if you see, 45% of the people will be available to use medicine if it was offered. And this category, it is only 37% in the category between 55 and 74. On the other side, we know that 30% of users living in elderly homes, this is a study done by the Scottish National Telecare Development Programme, could remain in their homes using telemonitoring or telemedicine services or telecare services. And this is another study always done by the Scottish because of the 11% of reduction hospital admission using AAL, so active assist living technology, and 31% reduction of emergency hospitals admissions. A lot of studies, a lot of European projects. One of the things that have demonstrated that if when it was started to make a project in AAL only for saving costs, it was demonstrated that it is not real. So most of times costs are, there is not a real saving cost, particularly for the healthcare. Sometimes it happens that in the healthcare there is even an increase of cost, but in the overall system there is a lower cost, but above all is a better quality of life. What is happening that the baby boomers will be the new disruptors of the technology, because for this reason I said now, it's not a cost reason, it's a quality of life. And the baby boomer expect to live better, so they will be the disruptors of the new technology to be introduced in the care system. Just of the main concerns about the technology, we see it every day, so we have piloted several devices developed within European projects. So some of them are easy to use for senior citizens. Reliability of proposed solution. This is one of the main points. People don't trust sometimes don't trust innovative solutions. Technology aversion. Effort and cost of installation and maintenance. So for service providers to introduce a new solution sometimes means how much will it cost and which will be the role in the service pricing in the future, so for maintenance. Care and technology sometimes are considered as contradictory terms, so people think that more care, less contact with caregivers, so worse care, but but it's not true. So the studies demonstrate exactly the opposite, so more technology, more time to spend with the carer, with the user. And another point is innovative design, marketing and sales channels. So we have to be honest that most of the devices and tools provided in the care market, social care market, are today devices with 10 years ago technology. I just give here a short example. I was speaking before with the colleague from Newcastle. We have today on the left are technologies we today use, is normal technology found in the market. And on the right, there are new technologies coming from, from the US market. So totally new design, it costs less, are much more nice, it works the same, no battery problems, easy to install, plug and play, and that really you find in the market. And on the other side, you see a difference. So here we have, you don't see it very well, but it's a private assistenza shop in Italy. So it is one of the private care networks in Italy. And this is how it looks. And this is how Apple shop looks. So how things, we have even to think in this direction. So before discussing with the colleague from Newcastle saying that if you see in some private sectors, so when the sector is private, there is already a change. So more innovation in design and in in marketing channels. I just make here a list of tools that are already in the market for the care industry, for the care services, and most of them are focused in small category of services. Everything is too fragmented. Most of them are just online checkups. So Rubric is an American-based company. New Generation Helpline Lively is always a San Francisco-based company. Remote monitoring here is is a long list of companies presented in the market, most of them from the United States, but there are European companies as well. Online marketplace, so caregivers and families. There is no one actually in Italy, but there is in Europe, but it's something started to be done by Uber, so the taxi companies, they're doing something for the mobility of aging people. And there are American huge companies like Honor or CareLinks. Oh, there is an Italian company, the Family there, but they don't provide services, so they don't provide services online. Integrated, so home care plus residential care and care services are both, there's a Care Merge and Vitever. Vitever is an Italian company, so they provide a platform online. tour operator and dating for specialized for elderly like Adventure on Siege, and hardware solutions for elderly like Breezy is an English-based hardware company. Just what are we trying to do in social cooperative, so how we try to deploy the innovation in our services. This is our actual situation. So we are a social care provider. We provide all services from home care, nursing homes, rehabilitation centers, and even, so we have different contracts with different service buyers, service providers. Even we are the same service provider, even there is the same user, we have all the time to reuse and to re-upload data of the same user in different services. So it's a mess. It's something that in a normal service no one will never do it. But we do it. Here how it works. So for integrated home care is a regional authority. Okay, I did just make because or municipalities or private buyer. So all the time we are the same provider, but there is not possible to make an integration. So yes, sometimes there does not even exist a software to communicate with the buyer. And this is just one of the markets we are trying to work more in. The private market is the home care market. Just is a picture how the home care market looks. For example, we just see how many actors are involved in the same service. And actually, some communication exists, but there is not a system that can put all these people and share all this data just to have a better service, to have a less intensive working hour service, and maybe to have even a less expensive one. But it's not a cost point. It's just to have a service that can be done in a better way to spend more time with the user. So this is a picture. We start to deploy our solutions, and we are using exactly this the project, the Health Mob project, starting from here, so to introduce some innovative solutions. Exactly. So I'm not going through the details, the technical details, because our colleague later can share. But what we are trying to do is to make the same database for all users we are using, and we have already done it because because we have already existing solutions, but we are trying all to put all together, and just to and we have separated the market in two lines, so the institutionalization market and the dehospitalization. We don't do the dehospitalization, so we work more on social care services. So our main objective, our target, are users that stay longer at home instead of a nursing home, and not people that stay longer at home instead of the hospital. So it just must be clear. We are not working, for the moment, we are not working for the dehospitalization services. And exactly what we are doing is that, but this already, we are in piloting systems, so we already have the system, we have already developed, so it's not our system, we just took solution existing in the market and tried to put together. Is a service portal, user-centered for chronic elderly. We have put it online, all our services. One of the most complicated is just to price the services to be available online, just to make modular services and to make it available online for our existing users and even for new users. And even at cross-border level, so this platform is accessible from 8 countries, from doctors and users and operators from 8 countries. So all the services that we are providing can be accessible from people to other data. So if you go to data later, we go to detail because there are a lot of huge problems about privacy. But however, we are trying to put our services online, and at the other time we're trying to create and integrated packages and to integrate existing innovative technology in existing caring process, okay? In particular, so this is just a list of the modular services we are trying to do, is like a care checkup done by a care manager, is a remote monitoring, so in this case we have the Health Mob project with the comfort box and the Health Mob platform. Medical alert services, emergency calls are already market existing, solutions are different, but are just integrated to the same platform. Operator assisted medical monitoring, so this is one of the things that we try to introduce that is not the home alone monitoring, but is operator assisted monitoring, so medical devices used by an operator, not used only by the user. Home care services are the services already we provide, so basic and advanced home care services. Training for caregivers, according to the new roles that these caregivers have in the new services. And family learning, this is an innovative we are using together with the University of Ancona, so involving families in a modular protocol, having a standard protocol to involve families for pathologies. Exactly we are doing for these projects only for patients with chronic heart failure, but we have done the same. So involve family learning for users with Alzheimer, with dementia, and other, or BPCO. So we have standardized how family can treat with chronic disease, with chronic situation within the home. Informal caregiver collaboration and continuous monitoring, case management, and care center as foreseen by the Italian original legislation. As I said, one of the points we are aiming to reach is exactly to provide integrated personalized care service packages. So just to put packages together for user. This is our pilot for the Adri Health Map project. We are doing this one in Fano, under the Marche Nord Hospital area. We have 50 users for the pilot action, the 50 for the control group. There is a specific integrated protocol, so including, what we are trying to do is to include the pilot and to include the technology in the existing caring process. So we are not creating a new one, just making things working in the existing caring process. Home-based, and it works in this way, so we have a home-based passive monitoring kit. Later explain just 2 words about it. Operator-assisted medical monitoring kits. This is the innovative we have introduced compared to other projects we have done. Environmental monitoring kits is a comfort box designed by the University of Ancona. Family learning, cross-border mobility and users. We have considered the participation of users from different countries. User access and empowerment. The home-based monitoring kits are scales, sphygmomanometer, oximeter, and everyday protocol measurement prepared by the hospital. At the beginning, we prepared Bluetooth devices, but honestly it does not work, so it has no sense to give Bluetooth devices, and we are using normal standard devices. It's much easier to be used by user, and once a week the nurse goes home and use the Bluetooth device, and and this is the operator assisted medical control kit. So I said at home we leave standard devices that are normal monitoring done by the user, and this is the Bluetooth devices that the operator brings at home. Is an ACG, professional ACG, is a tablet, or it can be a smartphone. And there is sphygmomanometer, Bluetooth oximeter, weekly home measurements submitted by nurse. So the nurse makes the measurement of the ECG, the doctor in real time can check it, and there is a protocol so they can even make the evaluation in real time or can make it later. But at the same time, the nurse takes the copy of the data collected by the user during the week. So the user just have a normal block. And this is a comfort box designed by the University of Ancona. It's just collecting environmental data. And yeah, but is something standard in the market, can send alarms and everything. But everything is integrated in the same platform. Some issues to be considered. Most of the solutions in the market are standalone technology or ICT solutions. So there are no turnkey integrated solutions to be used directly with them. Before I had a discussion with the colleague, because we are lodged together from Newcastle, because of the difference between producers from United States and producers from Europe. I have been a couple of times to the Google, and they have totally different approach. I just make you a comparison between, this is on the left, is the main event for age technology in the United States, is the Age Tech Expo, and the other one on the right is the one in Europe. So is the AAL Forum organized this year in Ghent. You see the difference between the sponsors, which are the main sponsors. So on the Europe there is the European Commission, and the other, if I'm not wrong, are local authorities. So most of people are policy makers and research centers. If you see United States, you see Amazon, Google, Yahoo, and the other are, most of them are or consulting companies or are service providers. So there is a huge difference. So I don't know if it's right or not. But for sure what is happening that the American solutions are much more easier to be commerced, are much more near to the market. Because maybe people that participate in their development are near to the market. So people that really know the market. I don't know if they know the user, but for sure they know the market, and they are able to provide solutions much easier to be introduced in the market. As I said, most of the solutions, we are trying to use some solutions. Most of them are US based, so, but all of them are entering global market because are all certified with European certification. As I said, one of the main points is that does not exist integrated packages. So technology, care operators, medical or healthcare services and diagnosis or lab services. Actually, they are not in the market. The new technology is much better adapted to to the private market than to the public one. For example, in Europe, this is a huge problem because most of the market is a public market. Just to give an example, so if you move people from the healthcare services to the social care, so technically people stay better. What happens in Europe? There are two different service buyers, so you have to move money from the regional authority to the municipalities, and it never will happen. In systems, when this is the same buyer, like Denmark, or where are private buyers like Germany with insurance, sometimes it works. But as I said, but new technologies are much more adapted to private-based system, and they're quite complicated for the public one. And all solutions of a market that is too fragmented. For the moment, there are no Apple and no Google that can make the market. But who knows? In the next year, I hope that it be something from Europe and not from the United States. But however, okay, this is all. So if you have any question, please don't hesitate. Thank you very much.